Hi everyone, my name is Jesse Sengillo. I'm a resident at Bascom Palmer Eye Institute. Thank you for the opportunity to speak today. The title of my talk is Photokeratitis during the COVID-19 pandemic. I have no financial disclosures. I'd like to start with a case presentation which will segue into our discussion. This is a 59-year-old female who presented to the Bascom Palmer emergency room with complaints of acute photophobia and foreign body sensation in both eyes. She had no past medical history and reported no systemic medications or eye drops. Her past ocular history was significant for cataracts, and her social history and family history were non-contributory. She specifically denied trauma, chemical exposure, and contact lens wear. At initial exam, her vision in the right eye was 20/20 and 20/25 in the left. Intraocular pressures were normal, and her pupils were normal, as were extraocular movements as well. This is a slit lamp photograph of her right eye under fluorescein stain. We can see in an interpalpebral distribution, there is pretty dense punctate epithelial erosions of the cornea, which are pretty confluent centrally. And this was the same in the left eye, which isn't pictured here. Here's a more detailed explanation of the exam. We can also see that her conjunctiva was injected in both eyes as well. So normally for a patient presenting like this, our differential would be pretty broad, including an exacerbation of dry eye, contact lens overwear, viral conjunctivitis, topical drug toxicities, foreign body, chemical exposure, thermal injury, trauma. However, our patient didn't give any of this history and actually denied these things. But upon further eliciting more history from her, she described the improper use of a new lamp, which she called a COVID lamp, the day before, which was approximately 8 hours before presentation. And the presumed diagnosis of UV photokeratitis was made. So for this talk, I'll go over a background of UV-associated photokeratitis. I'll talk about germicidal lamps and their increased use during the COVID-19 pandemic, and then we'll go over some observations at our institution. So to start, this is the electromagnetic spectrum, which we may all remember from earlier in our education. The ultraviolet end of the spectrum sits adjacent to the visible end of the spectrum. And we have three major wavelengths in the ultraviolet range, being UVC, which is shorter wavelength ultraviolet light, UVB, which is somewhere in the middle, and UVA, which is a longer wavelength ultraviolet light. Interestingly, UVC is absorbed almost entirely by the ozone layer. No UVC essentially gets through to the Earth's surface. However, UVA isn't absorbed by the ozone, and UVB is variably absorbed, or a proportion of it can be thought of as being absorbed. So how does this, what does this mean for the eye? So UVC interacts very particularly with the ocular surface, and actually doesn't make it much further than the cornea at all. UVB has greatest impact on the lens and structures posterior to the iris, whereas UVA is our classic, is what we classically think of as causing solar retinopathy, or being the main culprit for chronic exposure, which may put us at more risk for things like age-related macular degeneration, as this diagram shows. But we can also use it in a controlled setting in ophthalmology. So rose bengal has been used as a mediator for photodynamic therapy, which can be used in select cases of infectious keratitis. And then we can also take advantage of ultraviolet light with corneal cross-linking, where we sensitize the cornea with riboflavin and irradiate it for a specified duration of time with UVA irradiation. However, in an uncontrolled setting or with inadvertent exposure, you can sustain damage to the corneal epithelium. Symptoms range from foreign body sensation to severe pain and photophobia, and this is what we refer to as UV photokeratitis. The typical demographic this happens in is beachgoers, skiers, and the classic arc welder story as well. So for these situations, the beachgoer, there's a lot of reflected light off the water, as with the skier and the smooth surface of the snow, but also for skiers, particularly, they're at a higher altitude and less UV light is being absorbed by the ozone because of that altitude. And for arc welders, during this activity, there's a lot of different wide range of wavelengths that's emitted, but one is ultraviolet light, and without proper protection, UV photokeratitis can occur. How about artificial lighting, though, which is the direction this presentation is going? Well, there are many reports, mostly as case reports and case series. However, sometimes it's referred to as nightclub photokeratitis, where ultraviolet light, which is used as a decor, causes exposure to customers and results in a UV photokeratitis. It's also been reported in simpler settings such as a restaurant or a movie theater, and usually in these situations, or at least what's described in these reports, is either a dysfunctional or broken germicidal lamp in which a person is exposed. So what about germicidal lamps during the COVID-19 pandemic, and how does this relate to our patient? Well, there's been an increased amount of media outlets referring to ultraviolet light and what it could possibly mean for our way of battling against the pandemic being COVID-19. So you can see here there's some recent headlines. And there's also been an increase in the amount of consumer available germicidal lamps. This is a picture taken from a simple internet search. And right now there's an increasing number and very wide availability of simple UVC emitting germicidal lamps, which you can purchase direct to consumer and put in your home or your workplace to help sterilize the environment. Although the manufacturers for these products generally provide instructions which very explicitly state to stay away from the source while it's on to limit exposure to your skin or to your eyes, the advertisements for these products can be misleading at times, unfortunately, as you can see here. And this has actually been already reported during the pandemic. Well, earlier in the pandemic in Hong Kong, there was a family of 3 patients who sustained phototoxicity from UVC emitting germicidal lamp, which was used to help sterilize their home. And in this report, it was mentioned that manufacturer recommendations were not followed. What's the data about UV light even working for COVID-19? Well, there's no specific study looking at UV light in COVID-19, but there are some studies that look at coronaviruses that are similar to COVID-19. So a recent study published by Banal looked at UVC range, which is 222 nanometers specifically for this study. And it was found that within 25 minutes, 99.9% of the virus was inactivated. Now, this was a controlled setting, and it was tested on coronaviruses that were not COVID-19, but it did show good efficacy in this case. Along a similar line, Hebling et al. Looked at a meta-analysis that they performed in which they identified 30 publications which attempted to address this question of UV light against virus. And they found variable experimental conditions across studies, but all reported successful virus inactivation. And what they concluded from this meta-analysis is that UV light is effective against coronaviruses that are structurally similar to COVID-19 when used in the UVC range. Now, there's no data or evidence specifically for ultraviolet light right now against COVID-19 specifically, and the World Health Organization recommends to avoid direct skin or eye contact with UV light to prevent damage. A very reasonable question to stem from this is, what about using eyewear protection to help prevent UV photokeratitis from germicidal lamps as it become of increased use? Well, most standard non-tinted eyeglasses, such as, for example, polycarbonate, do absorb short wavelength UV light very efficaciously. Almost 100% of UVC is absorbed by non-tinted eyeglasses. The controversy actually comes from UVA and UVB range, where the range that companies advertise being protected against may actually not be very representative or may be misleading. There's a wide variability in the near UV protection, being UVA and UVB for that reason. Regardless of all this, mannequin studies do show that 20% of UV light does arrive to the cornea from the side, where the lenses may not be protecting. So this is something to consider as well. So what have we observed at our institution? So far, there's been over 10 patients that have come through the Bascom-Palmer Emergency Department with UV photokeratitis from germicidal lamps. And our characteristic exam that we're finding is that of classic UV photokeratitis. There's diffuse conjunctival injection. The cornea has diffuse epithelial erosions, which are mostly in the interpalpebral distribution, and there's no intraocular inflammation typically. These patients respond very well to topical artificial tears and antibiotic ointments to prevent infection. And it's also important to note that patients are reporting exposure in a variety of settings, not only just at their home where they're bringing these germicidal lamps, but also at their workplace, where an employer may situate one of these lamps to help create a more sterile environment. Or even one patient reported having been exposed at the dentist office. The particular office was using germicidal lamps to not only sterilize the room prior to procedures, but also to sterilize the patient for the COVID-19 pandemic. So what we would like to conclude from this is that direct exposure to UVC emitting germicidal lamps should be avoided. For patients that decide to use germicidal lamps in their home, they should follow manufacturer recommendations very closely to help prevent any unnecessary injury to their eyes or skin. And although UVC is shown to be effective against coronaviruses that are structurally similar to COVID-19 with pretty high efficacy, right now there's no direct data or direct evidence to suggest in-home use right now against COVID-19 specifically. Physicians should be aware of the symptoms and exam findings for UV photokeratitis from these germicidal lamps, and this becomes even more important as the popularity increases during the pandemic. I'd like to thank my mentor, Dr. Amescua, and also many residents and fellows who assisted in the care of these patients, and also specifically Drs. Perel and Dr. Sliney for extensive intellectual discussion prior to this presentation, and also Alex Rodriguez in the photography department as well. These are my references. Thank you for allowing me to present today.